Lisiak from Legacy Physical Therapy, back again to talk to you more about the 10 most common signs that you may be dealing with pelvic floor dysfunction. In the first video, we talked about how common pelvic floor dysfunction is. In our second video, we talked about the 4 common bladder signs that you may be dealing with pelvic floor dysfunction. And today we are going to talk about the 2 common bowel signs that you may be dealing with pelvic floor dysfunction. Yes, no one wants to talk about the bowel issues, but they're there and there's things that you can do about them. So one of them is fecal incontinence. This can be in the form of leaking fecal matter, whether you know it's happening or not. It can be on having a smear of fecal matter on the your underwear, or it can be a complete loss of fecal matter. Say you get a strong urge to have a bowel movement and you can't make it there in time. It can also be in the form of uncontrolled gas. So a lot of women I deal with say that they, especially since having their babies, they have a difficult time controlling any of their gas, and it seems to be happening more often. And that can often be a sign that the pelvic floor muscles are too weak and are not doing what they need to be doing. So fecal incontinence, again, not a topic a lot of people want to talk about, but it's out there and it's more common than you think, and there's conservative things you can do about it. On the opposite end of the bowel spectrum is constipation, or constant straining to have a bowel movement. So if you're having bowel movements infrequently and you have to strain really hard to have a bowel movement, that can be a sign that your pelvic floor muscles are not letting go and relaxing the way that they need to in order to have a bowel movement. And so again, a sign of pelvic floor dysfunction, which can over time wreak havoc on your pelvic floor and is a common risk factor for women developing something known as a pelvic prolapse. So if you are a chronic constipation person or you are a frequent strainer to have a bowel movement, you need to make some changes to help protect your future of your pelvic floor. So again, this is Brooke from Legacy Physical Therapy talking about the 2 common bowel signs that you may be dealing with pelvic floor muscle dysfunction. And I will be back again in the next video talking about common pain signs that means you might have a pelvic floor dysfunction. See you next time.